Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya, and in today's class let us concentrate about the functions of the electrolytes. So in the last class we discussed what are electrolytes, where they are found in the body, how is the electrolytes distributed in our body, and in today's class let us concentrate about the functions of the electrolytes. So all these sodium, chloride, bicarbonate, sulfate, magnesium are the important electrolytes which we see in our body, and they perform various functions like could be regulation of body fluids, like chloride which will help in digestion, bicarbonates which will help in intestinal peristalsis, transmission of nerve impulses, bone development by the calcium, regulation of muscle contraction, cardiovascular function. All these are the functions of this electrolytes. So I have jotted down all these functions of electrolytes. Let us see how they actually do these functions. So I have told you that the water balance in our body is very adequately maintained. So the amount of intake what happens is balanced with the amount of output. So when we say a fluid intake, suppose it is 1200 ml per day. In food we have around 1000 ml, and metabolic water is around 300 ml. Similarly, the output will be balanced. How? Insensible loss would be around 700 ml per day. Sweat से 100 ml per day जाता है. अपने feces, stool और urine से around 2000 ml जाता है. So we balance the fluid intake and output to maintain the body composition of water. And I've told you that body fluids are divided as intracellular and extracellular. So around 70% if it is intracellular and around 30% is extracellular. So around 40% of body weight will be intracellular fluid, and around 20% of the total body weight would be this extracellular fluid. So the fluid is maintained in these chambers because of osmotic pressure, oncotic pressure, capillary pressure. So and these are maintained by the electrolytes. So ये जो भी pressure gradient है, इनके होते हुए ही ये फ्लूइड यहाँ पे रहेगा, दिस फ्लूइड विल बी हियर, एंड इसको मेंटेन करने के लिए वी नीड सर्टेन कॉन्सेंट्रेशन ऑफ दिस इलेक्ट्रोलाइट्स. दे होल्ड this water, they push the water, they pull the water, so that this gradient is maintained and we get this much amount of fluid in intracellular compartment and this amount of fluid in this extracellular compartment. So these electrolytes are very important, and these are maintained in the body by lot many organs in our body. Like you have the kidneys, you have the lungs, you have the liver, you have the pituitary, you have lot of hormones. Angiotensinogen is there, ADH is there, then you have the ACE, you have ACE. All these hormones and all these organs helps to maintain this electrolyte concentration. So whenever there is a decrease or increase in this fluid balance, we get certain symptoms. Like suppose if the interstitial fluid, if the fluid in the interstitial space, in the tissue space is more, then we get edema. That is what we see, the swelling of the legs, etc. So that is edema. So when the interstitial fluid volume is more because of increased hydrostatic pressure, like it happens in case of pregnancy, that is why we see edema. Or in congestive heart failure patient, the hydrostatic pressure becomes more and then the patient gets edema. Or there is decreased oncotic pressure, that is there are less of proteins, like in case of malnutrition, end stage liver disease, nephrotic syndrome because of the loss of proteins. So all this will change the pressure gradient and they can shift the fluid from compartment to compartment. So when there is increased interstitial fluid, it will lead to edema. So here you will see that patient will have edema, he will have weight gain, he might have dyspnea because of the fluid collection in the lung, he might have bounding pulses, there might be neck vein engagements. In children you will see that the fontanelles will be bulging, patient might have nausea, vomiting. All these are because of this disturbances in the fluid balance because of electrolyte imbalance, which leads to cellular overhydration. Now you will see that whenever such things overhydration happens, we give the patients diuretics, we restrict the fluids, etc., so that the balance is maintained. So now in certain cases there is cellular dehydration. What happens is there is loss of body fluids, particularly from the extracellular fluids. Suppose in case of loose motions or diarrhea, or patient is having uncontrolled vomiting, there is lot of fluid loss, that is from the extracellular compartment. So water loss is more than the water intake. Patient might be having fever, or he is not taking enough water, or patient has developed diarrhea, vomiting, he has having excess of urine output like in diabetes insipidus, he is having excessive sweating, patient has done a very heavy workout and there is excessive perspiration, he is not taken enough of water. In case of burns, in case of hemorrhage, all these conditions there is extracellular fluid loss, and you will see that patients will have symptoms of cellular dehydration. Patient will be very thirsty, he will have sunken eyeballs, he will feel very fatigued, very tired, he might get muscle cramps, he will have urine which is very much yellow, concentrated urine. Patient will have headache, he might become irritable, the eyes are dry and sunken, there might be twitching of the muscles, mouth is dry, saliva is sticky. So all these things can happen in cases of cellular dehydration. If you see the patient's heartbeat, it will be very high, BP will be low, respiratory rate will be high. So these are the symptoms which will come when the cells become dehydrated. So we will have to give the patient fluid replacement therapy, and we have to maintain the fluids. So these changes can happen when there is an electrolyte imbalance, which will lead to imbalance in the body fluids. Second is, these electrolytes are very important in maintaining our heartbeat. See, you know that whenever you see an impulse, this is caused by the sodium, this calcium and potassium. So all these complexes what you see in the ECG, this QRS complex, all the waves what you see, the P, Q, R, S, T, all these are nothing but the impulses which are produced by the electrical signals produced by these electrolytes. So whenever there is an electrolyte imbalance, when the electrolyte becomes too high or too low, क्या करता है, हार्ट का सिग्नलिंग में ये इंटरफियर कर सकता है. Especially potassium, whenever there is increased potassium, this might cause very severe damage to the heart. The heart might even stop also. Dehydration, an electrolyte imbalance, जब भी there is a dehydration, patient is having severe vomiting, so then the electrolyte imbalance will cause the heart to beat very fast, there is rapid breathing and the blood pressure will drop. The low potassium level, what it will do, it will prevent the blood vessels from dilating, so the pressure of the blood will rise, so there might be increased BP. Sudden cardiac death can happen because of this imbalance of these electrolytes. So these electrolytes play a very important role in maintaining the heart health. Potassium, I have told you that it is very important in nerve conduction. Low or high potassium can cause heart arrhythmias. Calcium is also very important in maintaining the heart rhythm. Too much or too little of calcium can cause problems. Similarly, chloride. These electrolytes play a very important role in the muscle contraction. So, if there is an electrolyte imbalance, you will see that the patient complains of muscle cramps, muscle fatigues, etc. because of this electrolyte imbalance. So these sodium, potassium, all these are functioning by producing the electrical signals at the neuromotor junctions. They will stimulate the muscles to contract, relax. So when these are imbalanced, the muscle functioning also gets hampered. So our cells use these electrolytes to conduct the electrical charges whenever the muscle will contract. Calcium, magnesium, they are very important for this muscle contraction. Electrolytes are important in maintaining the brain function also. For example, you see here potassium, they help in memory, they help in learning, they help in increasing the blood flow in the brain, they will help in the signal transmissions, the production of neurotransmitter, they enhance the cognitive performance. So they are very important in brain function because in the brain also they will help to maintain the fluid balance. It is why suppose if the patient is having severe vomiting, he has lost a lot of fluid, after some time the patient starts talking rubbish, he becomes comatose, he will not know what is happening. That is all because of alteration in the fluid balance in his brain. This electrolytes are very important in sending electrical signals, nerve impulses, which are important in memory recall, muscle contraction, thought processes, etc. These electrolytes help in the cognitive health of the brain, and also they will support the brain cells and turn the nutrients into energy. So this is very important functions of these electrolytes on the brain. So I've told you, see, this is a magnesium. This will helps in neuroplasticity, in stress management, mood regulation. All these things are maintained by these electrolytes. So electrolytes, their function on this excitable tissue, may it be muscle, may it be heart, may it be brain, they have a very important role. Whenever there is an deficiency or an imbalance, they will cause twitching, they will cause tetany, they might cause bradycardia, tachycardia, they might cause coma, altered mental status, or sometimes even seizures, fits, etc. So electrolyte imbalance is very common condition which we can see in patients who are having severe vomiting, diarrhea. They are not taking enough of fluids and they are not eating enough. There is excessive sweating. They are on certain medicines like laxatives, diuretics, which is helping to remove excess water from the body. Eating disorders, if there is a problem with the liver, if there is a problem with the kidney, a patient is on cancer treatment, patient having congestive heart failure, all these conditions can cause electrolyte imbalance. Whenever there is an electrolyte imbalance, certain symptoms appear, like it can be mild, moderate, severe. Mild, whenever there is a mild imbalance, the patient might have no noticeable symptoms. Suppose if there is a moderate electrolyte imbalance, patient might start feeling fatigued, he might start getting headache, he might be having muscle cramping, muscle weakness, he might be confused. Suppose if there is severe electrolyte imbalance, the patient will have dizziness, irritability, nausea, vomiting, lethargy, brain swelling. He might even throw a fits, seizures. He might go into shock. He might even die. So these are the symptoms of electrolyte imbalance. So other symptoms of electrolyte imbalance would be diarrhea. Patient can sometimes have constipation. Patient can have irregular heartbeat, that is arrhythmia. He might have tingling numbness in his limbs, fingers, toes, and sometimes there might be difficulty in breathing because of the congestion in the lungs because of fluid accumulation. Electrolytes are very important for maintaining our normal body homeostasis. They play an important role in the fluid balance, acid-base balance, heart functions, muscle function, nerve functions, brain functions. So imbalance of these electrolytes will lead to all these symptoms. So these are few of the functions of the electrolytes. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.